practice. And then I ended up going to medical school, and I got a scholarship to go to medical school through the military. So I joined the military and became a physician. And then, you know, fast forward 15 years of practice in medicine. And, you know, now, you know, after doing so many jobs, I'm a little bit older than your average doctor. I have 15 years of medicine now, about 48. And I've got a gut. I'm a fat guy going through the hospital and working in the emergency room. And I'm trying to lose weight by drinking skim milk because fat, you see, is a problem. And I'm thinking, well, I'm going to drink low fat. It was the low fat era of you know, nutrition. So I'm eating everything low fat and non-fat. And I got chocolate syrup in that milk and crap like that. And it's going to get me nowhere. And I'm accumulating disease all along. So I'm 48 and I got an erectile dysfunction. I got a large prostate. So when I pee, for those of you that are young, you get ready for this. When you get that, it dribbles at you. It doesn't shoot at you. It leaves the end of your body and it just falls immediately into the ground, dribbles like a trickle. And there's no stream anymore. There's hardly any noise, just a little droplets. And you're getting up all night long to pee very frequently. It's a miserable existence. And then I had heartburn and esophageal reflux and a condition called Barrett's esophagus, where I had precancerous lesions in my esophagus, necessitating me to have a medical scoping procedure for biopsy to detect cancer as soon as it happens, so I can get going on chemotherapy and radiation as soon as I get cancer. I mean, you just imagine the fate, that kind of an existence where you're literally getting biopsies, waiting for cancer, and nobody's getting me better. They just keep giving me more medicines. And I had restless leg syndrome. I'd stay up all night long, keep my wife up all night long, kicking my legs. I snored. I had obstructive sleep apnea, so I'd stop breathing and gasping in the middle of the night. And that was very frustrating for my wife. And I had eczema, itchy patches all over my body, and bleeding and lesions, and I had atherosclerotic cardiovascular disease, clogged arteries. You know, I had tons of medical problems and chronic low back pain, debilitating chronic low back pain, and arthritis, and stiff as a board. I couldn't do any sports or anything. I just was falling apart. And then I meet a young guy who tells me about eating a diet back then called the paleo diet. Now, I know it's a bit dated and it had its time, but for me, it was the right time. And I cut out carbohydrates and I cut out processed foods. And it was about, fast forward a year later, because it's, you know, those changes, let me tell you something, if you're listening, those changes of disease come on so slow, you don't pick up on it. It's not like the first time you get a little disease, you pick up on it. You kind of ignore it till you're a train wreck. And that's just normality. And all around you, all your colleagues are train wrecks too. So the train wrecks don't look so bad because everybody's a train wreck. Well, the opposite also happens when you start getting better. It's so slow that you don't really pick up on the fact, you know, when you make lifestyle changes, and that's what happened to me. I made lifestyle changes. I cut out processed foods. I started eating clean. I ate meat and vegetables in whole form, you know, which is kind of the paleo dietary approach to eating. And about a year later, I'm standing in my bathroom, and for whatever reason, my eyes were open to the fact that now I'm blasting away with the urine stream into the toilet, making noises like I used to when I was a teenager. And then I reflected on this change in awareness that the urine isn't dribbling out of me anymore. It's now shooting out like it used to. And then I think about it and I realize I'm not getting up anymore at nighttime to pee. I'm not getting up 4 or 5 times a night, interrupting my sleep. And it hit me not like a brick, it hit me like a pallet of bricks. And I'm standing in my bathroom, and I tell the story. You know, most people would be like, "Wow, I'm so happy. I'm so happy I'm peeing. I'm not waking up." I was mad as hell. I was pissed off, so freaking mad, because what I realized in that epiphany was that I had been ripped off. I had had decades of disease and medications and smart doctors, including me, making decisions about my health care while I literally was falling apart, just getting more and more medicine. And then a patient who turned out, I thought he was like 23 or 24, turned out he was 17. A freaking 17-year-old punk tells me about paleo and he changes my life. Well, with all those medical problems going away, I realized, well, freaking an MD physician could be so misled. What hope is there for the average person who's never been to medical school, has no idea, is trusting all these doctors? So that's how I got to become a researcher. I said, well, I have got to figure this out. I've got to figure out what happened to me that, you know, dietary changes. Why didn't I learn about this in medical school? What the hell was I taught in medical school? And so I became a researcher. We got a grant from the National Science Foundation to study not just chronic disease, but the reversal of chronic disease, because that's what happened to me. How did that process happen? So we studied it and we realized animals in the wild don't have chronic disease. It's just one species that roams the earth that's got it, us humans. And so we dared to ask the question, my research partner and I, and we realized that animals eat what they should eat, they don't eat what they shouldn't, and they exercise very differently than us humans. And so when we tried to reverse chronic disease, we started using models that we saw were successful in the wild in humans, and lo and behold, it worked. And so eating clean, we started studying different forms of eating, cutting out processed foods, and then we looked at different modalities of exercise. There aren't animals out there jogging. They sprint. They get away from predators and they catch prey. So these series of sprinting. So we abandoned distance running, we abandoned distance durational exercise. We emulated basically the exercise patterns of animals, which are fights. I mean, animals are basically fighting. They're not out there exercising for fun or trying to look good. They're fighting other animals, either to kill it to eat it or to fight away a predator or a threat. And I'll blow up these images so you can see them a little bit better. And you can see this guy in this image has this big daddy bod, you know, dad bod. And in this MRI image, the cross-section through the abdomen, you see mostly white. So I like to tell my client patients and all my followers on social media that you want to have a abdominal MRI scan that's mostly black, not white, because white is fat. And if you are mostly fat inside, you're going to be unhealthy. And that's the way I was, and that's the way this guy is, with that belly sticking out with that purple arc showing that big dad bod, we call it here in America. So big MRI, filled with lots of visceral fat. And then in his image, repeated 3 months later, look how flat his abdomen has become. And look how less white. Now he's mostly dark. So that's your first biomarker we talked about, is visceral fat and how it's associated with that dad bod. And so that's an important one for people to be aware of, and they should, you know, consider getting an MRI to take a look at it. So here's another client, and we'll just blow up their MRI images, and you can see, again, mostly white. And then this image here, followed up later, you can see that they've reduced their visceral fat, and they now have more bigger muscles, and their abdomen, you know, that's enlarged in this image right here, is now become much flatter. And that time period is just 5 months. They did that, and this person is in their 60s, and 63 actually, and they were infertile. So they were married and they had no kids. Suddenly now they become fertile and they get their wife pregnant, you know, by getting rid of that visceral fat. So fertility, if you're struggling today and you're an infertile couple and you want to improve your chances of fertility, get rid of visceral fat. And visceral fat as an impedance on fertility. Nature doesn't want you to reproduce. If you got this bad biomarker inside of you that connotes and portends, you're not going to be on planet Terra very long to take care of those kids. So reproduction becomes very much a difficult task to attain because species doesn't want you to birth children and then disappear. So get your visceral fat out and you'll improve your fertility. So this is another example you can take a look at in abdominal scans. Two social media influencers, one of whom is me, and the other one I won't share. But you can see this abdomen has this arc here, so you can look at your pants. This curve here tells you, what's going on. So it's an anterior pier. So you can use your photographs of where you're at, and you'll find younger guys will have this kind of a flat abdomen here, and older guys, as visceral fat starts accumulating, will have this protuberance of their abdomen. So you can see what's happening with your waistline of your pants, and the arc that's created by those pants, shorts, give you an indice of probably how much visceral fat you have in. Well, let's look at this interesting abdomen here. We talked about this one earlier before the show got started. I think it's worth exposing. This is a slice through the abdomen up and down. So this is the back, the person's back, their buttocks, their abdomen, and we can see their internal organs sliced through their abdomen. So their abdomen, look how flat that abdomen is. There's no bulge pushing out. There's no bulge. And if you look at a slice of that abdomen in that MRI image, we can see that there's no visceral fat in there. It's all dark. In fact, this is one of the single best abdominal scans I have ever seen in a human being. And what's remarkable is, let's take a look at that individual. Look at that person's body, but look at their hair. This is a 59-year-old social influencer on Instagram. If you want to follow her, her name is Carolyn LaBouchiere, woman of 59. She's elegant, she's beautiful. It's because she's healthy. And the reason she's healthy is because she adopted a low carbohydrate diet. Now, I know there are a lot of people probably listening that think carbohydrates are good, but I will tell you, as a man afflicted with a passion to optimize human beings, I have studied all matters of eating and lifestyles. And the ones that have cut out carbohydrates the most and for the longest period of time have an advantage over those that continue to consume carbohydrates, particularly in large numbers. This is a series of 6 scans, and this individual is 68 years old, and you can see a lot of visceral fat, within their abdomen and the fat within their oblique muscles. So what we noticed from decades of studying visceral fat is that it accumulates also in the muscle. To the extent that you have visceral fat, you get this deposition of inflammatory fat within your muscles. That means your arms and your legs. And so this individual goes, through a period of 35 weeks, and they've lost a huge amount of visceral fat by the time they get there, and the shape of their abdomen is significantly improved. Now they got a shape like a college student in their 20s, despite the age of 68. And the only thing they did, Martin, was they cut out processed foods and mostly processed carbohydrates. So the elimination, they didn't eliminate all carbohydrates, but more processed foods. So they ate vegetables, which contain carbohydrates, but they ate clean. They didn't eat it in a processed form. So it's just meat and vegetables that they consume. And so you see this dramatic eradication or elimination of visceral fat as a consequence of that. So I am not an extremist where I think that the way of eating is a light switch, either all or nothing. It really is more about quality. So when you think about macronutrients, protein, fat, and carbohydrates, while I preface my comments at the beginning by saying the human being that eliminates more of their carbohydrates lives a better life, it is impossible to go through life without some consumption of carbohydrates. I mean, I will tell you, as a carnivore physician, and I eat fermented vegetables and fruit, and as much as I purpose to eliminate all carbohydrates, I know a small degree of carbohydrates are coming in still in some of those fermented fruits and vegetables, but an even larger amount of carbohydrates are coming in the form of the meat that I eat, because there is glycogen. I eat raw liver. And there's a lot of glycogen, which is a carbohydrate stored in the liver of those animals. So I'm getting carbohydrates, but I will tell you, the quality of that carbohydrate rocks compared to your ice cream and your muffins and your donuts, and you think you can get away with it because you're a young person, it's going to catch up with you. So I would prefer, and I work with clients to get them to understand that it really does amount to the quality of the calories, whether it's in the form of a macronutrient of a protein, fat, or carbohydrate, the source of that. If you're young, there's this black line that's around your eye called a limbal ring. And you can go to a mirror and take a look at the iris is the color part of your eye, and this dark ring. And to the extent that you have preserved that dark ring, you have lived better. Younger people will not acquire as much chronic disease to have eliminated that dark look of their eye. This is a famous photograph from I think it's around 1978. She was on the cover, if I'm not mistaken, Life magazine or National Geographic. And this photograph was taken around the world, shown around the world. This was like one of the most popular photographs of all time. And it's because of those stunning eyes, and those stunning eyes are because of that dark limbal ring. And we see this in, models that are attractive. So this guy looks like, kind of a steady guy. I wish I looked like that guy when I was younger. And then there are also present younger kids. So let's take a look at these two images of this girl age 10, and then she's 20 here. And you can see her darker rings, but she's still got them preserved at the age of 20. So these rings start to dissipate, not because you get older, but because you get more disease. Do you see this eye here with the white ring?
Yes.
Yeah, so that's what happens. You lose your dark ring, and by the time you're in your 60s and your 70s, you get this layer of phospholipids that start depositing around the iris of your eye. And you get, instead of a dark ring, you get this white one, and there it is up there. That white ring, maybe you can see it better, whichever one of those two images. And so it's kind of the opposite. So you can track your eyes and see how healthy you are. The truth is, I lost mom by the time I was in my 40s. And so I should be paying attention to see if you can recover it. To the best of my awareness and knowledge, I don't think you can. But something else you can pay attention while you're looking at your eye that's on your face is take a look at your nose. So do you see these dots on your nose, on this person's nose? Somebody might say, well, those are blackheads. The truth is, they're not blackheads. They're not clogged pores. These are pores that everybody has on their nose, but you have this awareness pre-programmed that helps you to know what is attractive, what isn't. The reason why this one is not attractive is these dots here are oil that's been oxidized. So this person lives in a body that's highly inflamed, and the oil within those glands become much more vulnerable to oxidation. And when oil becomes oxidized, it gets dark. Now, if you go to your mirror and you have these dots, that means you have a higher level of oxidation. And I will tell you, you are eating too much processed foods. We see this, especially, it's not as much a ton of ground up hamburger. It's going to be muffins and donuts and cereals and pizza and things like that, or the processed carbohydrates. So if you don't have those, that means you don't have as much, levels of oxidation within you. So the other factor is just looking at the size of the nose. So this individual here has a very inflamed face, an inflamed nose, and over the course of 1 year, they've dramatically changed the appearance of their face and their size of the nose as they eliminated visceral fat. And you could open up someone's abdomen and cut out their visceral fat, but the real change in the person's life comes from their lifestyle changing, where they stop pouring on the gasoline on that fire. So they've cut out processed foods, which eliminates further contribution of that visceral fat. If you just did a laparotomy, which is the medical term for opening up an abdomen, and you eliminated through mechanical surgical intervention the presence of visceral fat, you would temporarily improve the person's health because they won't be accumulating, but the damage would have already been done through the influence of visceral fat's secretion of these inflammatory molecules. So you really haven't cured them from the harm of visceral fat. You've just eliminated visceral fat and its further contribution for a day or so. Because guess what's going to happen unless you change your life? You're going to just go back and start secreting, greater composition and deposition of visceral fat within your abdomen. So the way to eliminate visceral fat is through lifestyle changes. Okay, hyperpalatable foods. They're designed to appeal to the taste of humans, to titillate those senses. Is in doing so, you are attracting a different type of species of microbes that are going to reside within your microbiome. So your food source that's in your environment attracts different species based on the type of food. Why should it be any different for the human gut and the species of microbes that reside within our gastrointestinal tract? So that is the simple reality, is how you eat dictates the composition of species that reside within your gastrointestinal tract that make up our microbiome, of which people have very little understanding of these species. What's interesting is the species defines what your life is going to be like because they influence your health. So for instance, science has shown that people like yourselves who are motivated to exercise, and nobody would argue that you are not motivated to exercise. In studies that look at the species of microbes within people that are motivated to exercise, they possess a certain species of microbes which are absent in couch potatoes. So the couch potato who doesn't exercise lacks these microbes. And so what's happening is where they're present, people are motivated to exercise. These microbes are influencing their hosts. They literally influence their lifestyles. And so they influence us to eat for them as well. So if those microbes, and let's open up reality, how many they're down there. You have 10 trillion human cells, but the composition of these microbes live in you are around the order of 40 to 70 trillion different organisms. You are more a collection of other organisms than you are yourself. And so all of them have different needs in terms of foods, and they begin to influence the hosts that they occupy to get them to eat from them, because the reality is they can't leave your body and go shop at McDonald's and get what they need. They got to get you to go feed them. And that's the simple explanation, men and women. If you suffer cravings for food and you can't stop eating that which you don't want to eat and you hate and you know is bad for you, but you are powerless, just recognize it's the microbes inside of you that are wired into your system to eat for them. And the solution to getting past those cravings is stop feeding them, because they're going to die in minutes to hours, and those cravings will go away. And then you got to start consuming your environment with healthy microbes like that come from traditional foods like kimchi, kvass, fermented foods. And that's why I have all my clients eating fermented foods, so that they, as those species of microbes that cause those cravings are abated and they eventually leave their body, you replace them with good soldiers. Just like when we, in the U.S. military, I'm still active duty lieutenant colonel in the Army National Guard, when we were present in Afghanistan in large numbers, the Taliban had to exist in caves. They couldn't be open and out. But as the U.S. military retreated, the Taliban now have come out and they're more prevalent. So as you get more beneficial microbes from eating traditional foods and eating healthy meats and eating healthy forms of vegetables and healthy forms of fat, then those microorganisms that are aligned more with a healthier diet take residence within you, and you no longer suffer the ravages of a processed food-driven diet, which is, the defining characteristic of existence of somebody who eats a lot of processed foods is cravings. When I see disease and affliction going on inside my body and my clients, I like to expose it and not sugarcoat it. And so that's why I think the MRI is useful. And so I'll pull up this other biomarker, and hopefully it shows up. These are spider veins. And by and large, they're regarded by the health community as relatively benign, right? I mean, if you look at those things, they're probably not contributing to much disease. What it is, by way of explanation, how do you get spider veins? It is the accumulation of poorly oxygenated blood accumulating within these vascular structures. Now, what should happen is that blood should be flowing through so quickly that it's not slowed down and causing this swelling. It's basically backing up. The pipes are not working as well. The pumps that are responsible for keeping the pipes clean are not working as well. And so we get this manifestation, these spider veins. Well, a lot of people, believe that they're harmless. What's really the problem is belying the spider veins' existence is our poor lifestyles and processed foods causing this production. So I encourage, mostly women typically have more spider veins than men, but men have them. If you eliminate processed foods, clean up your diet, these spider veins will disappear. And so you can see them, interestingly, on your legs, your ankles, and on your eyelids. So you can go and look in a mirror and see if you have these purplish veins on your eyelids. And then interestingly, on males, their skin on their penis, if they're not circumcised, it's their foreskin. It's what's, I say foreskin, I generally say foreskin. It's any skin on the penis will have, as you age, it becomes this organ that reveals your health, like your face. And, it's not well known within the public knowledge, but for us physicians that have to do things like hernia checks and urologists, a 60-year-old, 70-year-old, 80-year-old penis looks very different than a 16 or 20-year-old penis because of this, venous stasis that's on there. But remarkably, you can take a 70-year-old male that's filled with spider veins on his foreskin, on the skin of his penis, get him to clean up his diet, and it will clear up and start looking more like a 20-year-old penis as the blood flow starts going better. Now, why is that important? Why is blood flow important to the penis? All right, guys, make the connection. You want better blood flow. So if you have AD, if you're starting to have erectile dysfunction, take a look at your skin on your penis. You're going to see these purplish veins, and they will have slowly accumulated over a period of time that you haven't noticed them. But if you eliminate the processed foods from it and start eating healthy, doing some maximum intensity exercise, sprinting, doing some sauna, getting some sunshine, all those things will improve your health. Those spider veins will reverse, and guess what? The plumbing starts working better. And so I restore erectile functioning in my male patients by doing precisely that, and it really parallels the elimination of visceral fat, which contributes to inflammation, to the compromise of the blood flow and manifesting in spider veins and in erectile dysfunction and in poor blood flow to the organs and declining blood flow to your musculature, and we see sarcopenia, loss of muscle mass. So the muscles start deteriorating, but the tone of those muscles. So we see in the 70-year-old male who may still have some residual mass within their pectoralis majors, their pecs of their chest, the tone is diminished, so they start sagging. And that's because blood flow is no longer flowing to those tones. And another biomarker where blood flow is declined is skin turgor. So skin turgor is assessed by how fast your skin snaps back when you hold it up on the palm of your hand. So if you have access to a 10-year-old or an 8-year-old, watch how fast it slams back like a rubber band. And if you're 80 years old, you may pull your skin up and it stays right there. It slowly lays down, maybe over the course of like a half hour. So what a difference. But that's an important biomarker.